Are you sitting comfortably? Then I'll begin. I'm going to tell you a story about a young Viennese woman called Bertha Pappenheim, also known as Anna O, and the founding patient of psychoanalysis. Now, according to Freud, Joseph Breuer, who was Bertha's doctor, claimed that she had had a phantom pregnancy. This story is widely believed, particularly by therapists who interpret it according to their own particular school of thought. For example, it was the recreation of Breuer's wife's pregnancy, said one, while for another, it was the enactment of what she most feared, that a man would seduce, impregnate, and abandon her. But how solid is the foundation for this theorizing? The story first appeared in a letter from Freud to a friend some 50 years later, in which he described it as something he had reconstructed on the basis of what he had guessed as a result of something he had remembered, Breuer telling him in another context. So, how much better to get their stories directly from patients themselves, which is what I'm doing now in the case of another young woman, Freud's patient, Anna von Lieben. Here, I'm using interpretative phenomenological analysis, IPA, to explore her autobiographical diaries, which, to my incredulous delight, I stumbled upon in the cellar of a family descendant in Israel. Now, IPA is a research methodology which works with an individual's first-person narrative, and the researcher dialogues, as it were, with the text in a manner, a cyclical manner, designed to bring into focus and highlight the experiences described. Historically, the medical narrative has been dominated exclusively by physicians, and male ones at that. But now, with new person-centered methodologies, such as IPA, the patients are now able to make their voices heard, even if deceased. And here is some words from Anna herself. Well, okay, so I rest my case.